Another important area of social and emotional development is the development of emotions. Emotions develop in the sense that the way we experience emotions and the way we express emotions changes over time. With regards to emotional development in the first 2 years, infants go from pretty automatic reflexive responses to learned responses that are more intentional and that are more situation specific. Early on, newborns' emotional reactions are really reflexive responses to biological experiences. So we may see them expressing distress, contentment, even what we perceive as happiness when they have a smile or something like that. But to begin with, those are reflexive responses to biological experiences. They're responding to painful sensations or pleasurable sensations by doing things like crying or in some cases smiling. But again, to begin with, those expressions are just a response to biological sensations that they're experiencing. Eventually, however, babies begin to be more curious about the world around them and, as a result, more social. And so it's at about 6 weeks of age that we begin to see the presence of what we call social smiles. So in this slide, we see a baby exhibiting a social smile. And those social smiles begin sometime, again, between 6-8 weeks of age, something like that. To start with, a social smile is really just an involuntary smile in response to seeing another face. So these smiles help support bonding with caregivers, and likely to begin with, they're just a natural imitation of the caregiver. So they may be imitating what they see the caregiver doing. But they also show that the infant is paying attention to the caregiver. So we see those fairly early, around 6 to 8 weeks of age. And then we see some other things developing again within those first 6 months of life. So things like laughter, curiosity, those smiles that are much more situation specific and that type of thing. Sometime around 6 months of age, give or take a couple of months, we start to see anger. And in many cases, that anger is a response to frustration. So they can't have something that they want, they can't get to something. They may show anger because they're frustrated. Another thing that we begin to see around this time is sadness. So show displays of sadness that aren't necessarily based on those physiological experiences that they're having. Around 9 months of age is when we begin to see fear emerging in social events. And so a couple of the fears or a couple of types of fear that we see emerging during this 9 to 14 month age range are what we call stranger wariness and separation anxiety. Those names are pretty self-explanatory, but it's not until this point that babies show that fear of strangers. Beforehand, they don't necessarily respond to strangers in any way that's different from the way that they respond to their regular caregivers and their family members, people who are normally in their environment. But when they get to be about 9 months of age, somewhere in that range, they start to show that wariness or that fear of those strangers. Another thing that we see beginning around that same time is the development of separation anxiety. So this is when babies start to get upset when they're separated from a loved one, a caregiver that they're really familiar with. This coincides with the development of object permanence, something that we talked about earlier in looking at cognitive development and Piaget's sensory motor stage of intelligence. When babies develop that understanding that even though things still exist when they're out of their sight, that seems to coincide with the development of separation anxiety. So those are some things that we see beginning in those first months or that first year of life. Around 12 months of age, children will also show fear in regards to unexpected sights and sounds. So things that are really startling, that they're not expecting, that aren't typically there, those sensations can cause those fearful emotions as well. A lot of the emotions that we see in that first year of life are examples of what we call primary emotions. Primary emotions include things like joy, sadness, fear, and so on. And these are biologically based emotions that appear early in the first year, and they're associated with pretty distinct and universal facial expressions. So the facial expressions that go along with these primary emotions are pretty much the same from person to person, from country to country. So different parts of the world, people tend to express these primary emotions in basically the same way. So typically, these emotions are recognized across almost all cultures. But as children get into that second year, we begin to see the presence of what are sometimes called secondary emotions. We also use the term complex emotions to refer to some of these things. So here we're talking about things like pride, shame, and embarrassment. Pride, shame, and embarrassment are called complex emotions because these emotions all involve social awareness. And as we've already talked about, social awareness begins to develop through early parent-child interactions, but of course they continue to develop, and as children develop a wider social circle. And so as they develop that social awareness and they become more self-aware, aware of their behavior and how their behavior may be viewed by other people, that's when we begin to see the presence of some of these more complex emotions. And so these are some of the types of emotions that we see being expressed at different points during the first couple of years of life. Another thing that's important with regards to emotional experience is emotional regulation. Emotional regulation is the ability to calm ourselves and move from a state of high arousal to a state of lower arousal. Initially, infants depend on caregivers to help them regulate their emotions, such as the caregiver holding and soothing the infant, as shown here. And this is a process that's called dyadic regulation. But as children develop, as they get on into those years of toddlerhood and the preschool years, they begin to develop some emotional regulation skills of their own. To begin with, their emotional regulation skills are not that good. And so early on, we see the presence of temper tantrums and that sort of thing. And children may require adults to help them deal with those emotions and regulate that. But as children begin to have more social experiences and their brains continue to develop, particularly the frontal lobes of the brain, then they begin to be better at emotional regulation. So, again, another aspect of emotional development that comes along with time.